Vaginal dryness is actually a symptom that is more common in women than we actually think, and unfortunately most women shy away from talking about it. We can briefly talk about the causes of vaginal dryness. Number one, we have childbirth and breastfeeding. If you've just had a baby and you're currently breastfeeding, it is expected that your estrogen levels will drop. Do not panic when you start getting a bit drier down there. It is very normal. I did a video whereby I covered the postpartum changes that happen to most women after childbirth. You can have a look and get a more in-depth picture of the postpartum period. The second thing will be, of course, age. The older you are, unfortunately, the more prone you are to vaginal dryness, because estrogen levels production usually go down. This leads to the thinning of the vaginal walls, and when this happens, the moisture down there, the blood flow down there is compromised, and you are bound to experience more dryness than you were experiencing before. The other thing that will cause your vagina to dry up, of course, would be medication. As a side effect of certain medications like antidepressants, antihistamine, taking medication to treat endometriosis, maybe you're treating fibroids and such, usually affect the production of estrogen, or they lower the production, and this will have a negative effect on your dryness and your moisture down there. The other thing will be alcohol consumption. Alcohol is a sterilizer. It wipes out the good and the bad bacteria, and this affects the pH of the vagina. That is the first effect. The second thing, it will dehydrate your cells. Of course, people will tell you, oh, when I'm high, I get easily aroused, I'm well excited, sexually excited and such, I can go for rounds. But unfortunately, it is a very short-lived experience, because you will be dehydrated. And of course, the vaginal cells will also be affected by that, and that will cause you dryness down there. Control your alcohol intake and reduce over drinking, over smoking. Smoking is very bad for your vagina. The other thing will be hormonal contraceptives like the e-pills, the emergency contraceptive pills, the daily pill, implants. Any sort of hormonal contraception usually has a negative impact on the vagina moisture. In Kenya, most people will tell you unakuwa baridi. No, it's not kuwa baridi. It's just that your estrogen levels have gone down. It will take you longer to get wet. It will take you longer to even have that libido, because your hormonal profile is usually compromised. If you can avoid the hormonal contraceptives, please do. You can use the non-hormonal, you can use condoms, you can use the copper IUCD. If you are good with counting and you're sure about it, you can use safe days. But I'm not saying that you go use safe days, then you can't tell me that, oh, Lillian, I got pregnant, you told us to use safe days. If you're not good with counting, if you're not good with your dates, please don't do that. Another thing that can cause you to have vaginal dryness is uncontrolled blood sugars, or if you are diabetic. Yes, it does happen, because uncontrolled blood sugars for long usually damage the blood vessels and the nerves that are usually responsible for being sexually aroused. That is the first negative effect of uncontrolled blood sugars on your sex life. The second thing is the damaged blood vessels interfere with the blood flow through the vaginal area, and this usually affects the moisture, the contraction and the relaxation of the vagina. This makes it hard or uncomfortable when you're having penetrative sex, because you will experience pain. You can even start bleeding and such things. If you have diabetes, please have measures put in place to ensure that you take care of your blood sugars to improve your sex life too. I did a video on controlling diabetes. I'll definitely link it up so that you can have a look after this video. And the next thing that will cause you vaginal dryness is frequent UTIs and yeast infections. It is also a sign or an indicator of having dry vagina, because when you frequently get those UTIs, yeast infections, it directly means that your cultures, the good and the bad, they are not at peace with each other. At peace, it means they are not at balance, and this directly affects your vaginal pH, which affects your mucus and lubrication status, and this will definitely predispose you to dry vagina or an itchy vagina or painful sex and such things. So you need to make sure that you take care of your diet, and you can always adapt something like microbiome diet. It is a diet that aims at increasing your good bacteria and reducing the levels of the bad bacteria, or ensuring that there's a good balance of the two. This is a very effective diet when it comes to taking care of the vagina, the pH, and reducing infections and improving lubrication. At this point, I am asking you to please subscribe if you've not subscribed, because I'll be doing the microbiome diet analysis next. If you're finding this video useful, give it a thumbs up and let's continue learning. The next thing that will cause your vagina to dry up is if you are on chemotherapy, radiotherapy, or any form of cancer treatments, because they definitely affect the endocrine system, the hormonal profiles and such, and then this will affect affect your estrogen levels. The next thing that will cause your vagina to dry up is not being sexually aroused. Yes, having an inactive sex life. It doesn't matter if you're single or not, you can always take matters into your own hands. Yes, there's always a self-pleasure. You can do maybe toys, vibrators, you can use your fingers. X-rated. I'll make sure that this video is rated because it helps in making sure that there's constant blood flow down there, because when you're sexually aroused, when you're sexually excited, blood flow will be transported down there, and it will help in ensuring this continuous production of moisture and the mucus, the lining and such, and making sure that the cells and the tissues are well aware that they're supposed to be well prepared for sexual activity. So not having sex is a bad thing, so make sure that you have frequent sex. If you're single or for any other matters that you cannot have penetrative sex, definitely use toys and find things that will make sure that you get aroused. The next thing that will cause your vagina to dry up is too much douching. You're overwashing it. The vagina cleanses itself. It is self-sufficient. Do not help it. Of course, you need to make sure that you clean your lips, your vulva with a clean cloth, plain water, and that's enough, or unscented soaps. Unless it's medically prescribed, do not insert anything on your vagina in the name of washing or cleaning it up or trying to make it tight. No, those things will affect your vaginal pH. They will dehydrate your vagina. They will make sure that you remain dry for longer. Those things are not accepted. If you want to take care of your vagina, please carry it like a baby. Give it the delicate attention it actually requires. Do not insert things inside there. The only thing that should go inside a vagina is the penis or a baby coming out of it. Any other thing that should go inside there should be prescribed or of medicinal purpose. Anything that is not of those two should not be going inside your vagina. The other thing that will cause your vagina to dry up is the surgical removal of the ovaries. You had some ovarian cyst, or you had some condition that necessitated for your ovaries or your tubes to be removed, then you will predispose to dry vagina, because again you're not going to be producing estrogen because your ovaries do that. Anything that will affect your menses, like when you stop having your menses, then your vagina will be predisposed to dryness. If you're in such a condition, make sure you see a gynecologist. They can prescribe for you estrogen creams or estrogen pills that should help with lubrication and making sure that the area maintains its moisture despite all this. The next thing that will cause your vagina to dry up is poor dietary habits. Too much sugars, refined foods, low intakes of fibers, both soluble and insoluble. And I'm not even talking about the synthetic fibers. No, I'm talking about the actual natural occurring fibers in foods. Low intakes of those usually have a negative effect on your body and your metabolic system, and they also have a negative effect on your vaginal health. You need to make sure that your diet is rich in foods like vegetables, foods that are rich in probiotics like maybe garlic, cabbages, carrots, fermented foods like OJ. You can do fermented grains, you can ferment your oats, you can ferment rice, you can ferment basically anything. You can drink kombucha. Make sure that your diet is rich in fermented foods, even for your vagina, for your gut health, for your body, for your skin, for your general well-being. As a woman, there's a lot of effect on diets, on the hormonal profile, so you need to make sure that you take care of your diet, all the antioxidants, the anti-inflammatory foods to help you keep your vagina healthy. Another thing, you can also increase your intake of iron-rich foods and vitamin C, and also foods that are rich in nitrates. Nitric oxide is basically the compound that helps in relaxation or dilation of the blood vessels, and it will help the blood flow faster to the vaginal area. This will improve the moisture and improve relaxation and improve penetrative sex. So foods that are going to help you in reducing blood pressure, improving blood flow, they are very good for your vagina, and you should take them up immediately. Having talked about some of the things that causes a dry vagina, how can you tell that you have a dry vagina? This will be self-assessment. If you get tears during sex, if you feel pain during penetrative sex, if you bleed, you don't easily get aroused, and also spotting here and there, and then you can also be having recurrent UTIs and yeast infections, like a burning sensation when you're peeing, like you're feeling like you want to pee like all the time. All these are some of the signs and symptoms that you can actually self-assess to see if you have a dry vagina.